Okay, so Dr. Platt, it's very good to have you here today. I'm really excited because this is a topic that we haven't really explored on the High Performance Health podcast. Specifically, we're going to be talking about adrenaline today and the interplay with other hormones. I know that you have a book all about adrenaline and the conditions that it's linked to. It's absolutely fascinating, and you're a real expert in this area. So first of all, let me welcome you to the show.
I'm glad to be here.
Yeah, it's great to have you here. I think probably a good place to kick off is most people listening will think of adrenaline as something that's released when we are excited. That would be the first place I'd jump. You think of a roller coaster or something like that. It seems that people have varying degrees of adrenaline, and it's pretty interesting the conditions you link it to. Let's start with, first of all, what adrenaline is, and so that people can understand it a bit better.
Adrenaline is a hormone, and it's also a neurotransmitter. It's both. And it's mostly known as, they call it the fight or flight hormone. So when people are in danger, the body just pours out adrenaline. And that's what it's mostly known for. But the interesting thing is that the releasing adrenaline in danger is actually a very rare occurrence. What most people do not realize is what the true function of adrenaline is. And and most people do not realize that the brain actually has more sugar than any other tissue in the body. And that's one of the two fuels that the brain has to have to function. So the body always wants to make sure that the brain has enough fuel in order to function. That is a survival concern. And so anytime the body detects a drop in sugar in the brain, it puts out adrenaline to convert protein into glucose. It's called gluconeogenesis. So the primary function of adrenaline is just to make sure the brain has sugar.
Okay. And so in a kind of fight or flight situation then, I mean, adrenaline, I think, is linked with cortisol as well, right? Presumably this is a way of fueling the body to either fight or hide or flee.
It's a very powerful hormone and a very powerful neurotransmitter. So, and when the body is in a fight or flight situation, it does have a lot of effect on the body. A very simple thing, people can experience cold hands and cold feet, and that's almost always attributed to an underactive thyroid. But actually, that's adrenaline, because adrenaline constricts blood vessels. It cuts off blood. It cuts off blood supply to areas of the body that are not needed for survival. Another example is irritable bowel syndrome. It cuts off blood supply to the intestines because they're not needed for survival. And it cuts off, and what people should also realize is that adrenaline cuts off blood supply to the salivary glands because they're not needed for survival either. So when people do hormone studies and they do saliva tests, I don't even look at saliva tests because adrenaline affects them. And so when they do a saliva test, they get a low cortisol in the saliva, and based on that, they diagnose adrenal fatigue, which is a condition that doesn't exist. If they did a blood test, they'd find the cortisol level is actually high because adrenaline is the hormone that creates stress in the body, and the body responds to stress by putting out cortisol.
Because cortisol itself is anti-inflammatory in nature.
Yes.
Yeah, and helps reduce pain. But then over time, right, it's quite catabolic if you get that sustained release. So with adrenaline, then I think we just normally associate it with excitement. Before we kind of come to that, and we were chatting offline about the link with things like creativity, you mentioned there about cold hands and feet, and this is something that a lot of people struggle with. A lot of people struggle with conditions like Raynaud's disease, where they don't know how to treat it. Are conditions like that something that you have also linked with adrenaline?
Yes, I have.
Okay, interesting. And that's because the body is cutting off, as you were saying, the blood supply to non-essential parts.
Right. This whole thing about adrenaline, as you may know, I've written a book called Adrenaline Dominance. And it's the only book that has ever been written that actually talks about adrenaline. why the body produces it, conditions associated with it, and how to improve it. So it's completely off the radar of the medical system. And as we go on, we'll talk about a lot of the conditions that are associated with excess adrenaline that are considered incurable. Because the bottom line is, in order to fix something, you have to treat the cause of it. And unfortunately, we have a medical system where doctors are not trained to treat the cause of illness. They're trained to give out Band-Aids. Basically, not always, but basically.
Yeah.
So but medicine is a passion for me, and getting people well, it's very rewarding. And unfortunately, doctors should be seeing more of this, getting people well.
And so with adrenaline, why would somebody have more or higher levels of adrenaline being released than the next person?
Well, the thing about adrenaline, this is a genetic marker. In other words, if somebody has a lot of adrenaline, that means that one or both parents also had a lot of adrenaline. And the other thing is that I have not observed that people that are creative have the most adrenaline. You've heard the term ADD. There's ADHD and there's ADD. ADD, these are people that have trouble focusing, but they're not hyperactive. But they're actually hyperactive in the brain, but they're not hyperactive physically. And so these are the creative type people. And why? And excess adrenaline, it begins at a very early age. Even when the baby is in the womb, those mothers that have a baby that does a lot of kicking, that extra kicking, that's adrenaline. And these are usually the babies that when they're born are the ones that'll have colic. And colic is always caused by excess adrenaline. And it's the kind of thing you can get rid of in about 3 minutes, just by putting some progesterone cream on the baby's belly.
That's very interesting. Very interesting. So what about then conditions like you talk about babies with colic, or they can get reflux? Adults can also get that sort of gastric reflux and distress. Is that also linked with adrenaline?
Well, I know that colic is. I think there are different reasons for the reflux, pyloric stenosis, or whatever. But and I don't see babies, so I can't be that cognizant of exactly what goes on with babies. But I do know that colic is caused by excess adrenaline, and later on, those children that are bedwetters, that's only caused by excess adrenaline. And again, you only see that in creative type children because, again, they have the most adrenaline. But you can get rid of bedwetting in 24 hours just by lowering adrenaline. And we'll talk about this.
Yeah, so let's talk about this, because I think that obviously in terms of neurotransmitters and performance specifically, you sometimes want to get close to the edge, right, to enhance performance. So presumably with something like adrenaline and things like dopamine, there is a sort of an equilibrium you want to reach, or a certain amount that you need at certain times to feel motivated to tap into that creativity. How can we manage that and have the right levels so that we can explore what we want to do and achieve, and perform at the highest level, but not get the unwanted effects?
Well, actually, the creativity does not cause the excess adrenaline. The excess adrenaline actually enhances the creativity. And so being creative itself is not harmful. But if you are creative and you realize that you are prone to increased adrenaline, that can be fixed. And see, when people have a lot of adrenaline, and they should realize that, a lot of people experience anxiety. The only thing that causes anxiety is excess adrenaline. And look at all the millions of people with ADHD. My book is actually the only book that ever talks about the fact that ADHD is caused by excess adrenaline. And you can actually eliminate ADHD in 24 hours just by lowering adrenaline. So, and to some people but what's interesting is that I get a lot of information about different conditions from different parts of the world, and you're in England, and they talk a lot about conditions like PMDD and cyclical vomiting syndrome and whatever, and they don't realize that these are conditions caused by excess adrenaline, and are fixable, actually.
And so would somebody be aware that they have excesses of adrenaline, or is it only when they develop these symptoms? And obviously most people are not aware, right? Because they're not aware of your research necessarily, but how would somebody know that they had excess adrenaline?
Well, first of all, people with excess adrenaline have trouble sleeping. They may have trouble falling asleep, and they will certainly have trouble staying asleep. They'll also may find they grind their teeth at night, or keep their jaw clenched. They'll get up at night to urinate because adrenaline gives people that urge to urinate. Even during the day, they on television they call it an overactive bladder, but those people, but adrenaline gives people that urge to urinate. And then people with excess adrenaline will find they're quick to anger, they're short fused, and they may have cold hands and cold feet. They'll almost always carry a lot of tension in the back of their neck. And this neck tension can cause tinnitus, ringing in the ears, and it can cause headaches, severe headaches that are always mistaken for migraines. They're called migraines, but the headache is actually something called occipital neuritis, which causes excruciating headaches, and the pain comes from the occipital nerve sheath at the base of the skull, and the tense muscle squeeze that nerve sheath and cause these severe headaches. Very often the pain shoots right into the back of the eye, and these headaches are very easy to get rid of, just by lowering adrenaline. Every condition that I talk about is easy to get rid of just by lowering adrenaline. And that's why it's probably important for people to understand that that they can actually have a lot of control over their health that they can't get from their doctors sometimes. And we'll
what
talk
is the
about
best
that.
way to lower adrenaline?
Well, first of all, you have to realize where it's coming from. And like I mentioned, that the body uses adrenaline to raise sugar levels for the brain. So people, instead of having the body use adrenaline to provide fuel for the brain, they can provide fuel themselves by how they eat. Now, the brain uses two different fuels. One is glucose, sugar, and the best source of glucose for the brain comes from vegetables. And then the other fuel, which is even more important, are ketones. And people hear about a ketogenic diet, which I don't recommend because it's a very difficult diet to accomplish. But you can get ketones directly from coconut oil, which is a great fuel for cooking, or something called MCT oil, medium chain triglyceride oil, MCT oil, which comes from coconut oil. And both of these oils convert into ketones. So you can get ketones for the brain by eating, by using these two oils. And it only takes about 24 hours to lower adrenaline. We're not talking about a long-term treatment program. So once people start providing the right fuel to the brain, there's a dramatic drop in the amount of adrenaline the body produces. And then the only other thing that needs to be added is a 5% progesterone cream. Now, progesterone cream is a hormone, and most people, including doctors, think that progesterone is a woman's hormone. They don't realize that men and women have the identical hormones, different levels, but the same hormones. And as it is, men stop making progesterone around the age of 50. And after men stop making progesterone, certain things happen to their body, and we can talk about that. But progesterone directly blocks adrenaline, and very effectively and very quickly.
That's interesting, because I had realized the link between progesterone and the production of GABA. And I was aware that, when you're producing GABA, right, we're engaging a more parasympathetic state. And when we have too much glutamate, we are more in sympathetic drive. So you can't have kind of high levels of glutamate and GABA produced at the same time. What you're saying is progesterone is also affecting the production of adrenaline.
It is. Yeah.
Okay. Which, and adrenaline then in turn is affecting the production of cortisol.
Yes.
Okay.
Correct.
So just tracking back a little bit before we talk about progesterone in more detail, you mentioned there about glucose for the brain and also for the ketones, right? And getting, rather than following a ketogenic diet, getting your ketones from things like coconut oil. So are you saying here that actually the combination of ketones with some glucose from things like vegetables works well? So it's not that we're trying to get into a state of ketosis, but taking exogenous ketones, or could you clarify how that would work?
I'm not, I missed, I'm sorry, I missed that question.
Sorry, let me clarify, if maybe I didn't explain myself properly. So you were talking about ketones being effective fuel for the brain and coming from coconut oil. You also mentioned that vegetables were a really good source of glucose, and that these two things in combination with progesterone cream were an ideal way, a trio, to lower the production of adrenaline. When we're looking at glucose from vegetables and we're looking at the ketones, are you saying then that we don't need to be in a state of ketosis? Or are these vegetables are low in glucose? Are you staying, or do you include starchy carbohydrates in that? I'm just curious whether it's just the addition of exogenous ketones or whether we need to then facilitate a state of ketosis.
Well, the advantage of being in ketosis is that the body's already producing ketones. But if you're providing ketones via coconut oil and MCT oil, you don't need to be in ketosis.
Okay. Okay. So
I
just
don't know
by having coconut oil could be helpful. And is
Yes.
there a specific time of day? Like, is this something that you would recommend, for example, in the morning upon waking? What is this? Does this have a biorhythm in terms of the production of adrenaline?
Well, you know, what it all comes down to is that the brain is using glucose and ketones for fuel. And the more active the brain is, the more quickly the body uses up these fuels. For example, a creative brain uses up fuel in about 3 hours. So there's not a specific time of day. Basically, it's throughout the day that you should be providing fuel for the brain, all depending on what you're doing. People that do a lot of exercise, you know, their muscles are burning up glucose. So again, another reason why they should be eating more vegetables, just to provide glucose. So everybody's different. There's no one size fits all. You know, people have to learn for themselves exactly what they need to provide the brain in order to function without a lot of adrenaline.
And when you're talking about vegetables there, are these all types of vegetables? Starchy and non-starchy, or?
Well, green vegetables are really good because they're zero glycemic. They don't produce any insulin. You know, white potatoes or starches actually produce a lot of sugar. However, there's a condition or something called resistant starches. I don't know if you're familiar with that.
Yeah.
And so people are allowed to have cold white potatoes, like potato salad. That's acceptable, but not hot white potatoes. But they can have sweet potatoes because they're lower glycemic. And what I actually recommend is when it comes to sweet potatoes, that instead of baking them, to slice them up and fry them in coconut oil. And that way people get both fuels in one side dish. And I also recommend that people eat something before they go to sleep. And the reason for that is that adrenaline peaks at 2:30 in the morning. That's when the highest levels of adrenaline occur. And in fact, a lot of people wake up at that time to urinate. And some women get hot flashes at that time. So by eating something before they go to sleep, the brain will have fuel so they can sleep throughout the night better. So and I recommend they're using progesterone right before they do eat. And progesterone for two reasons. Number one, it blocks adrenaline, but progesterone also blocks insulin. And the problem with insulin is that when insulin goes up, blood sugar drops. So when you get that drop in sugar, the body puts out more adrenaline to raise sugar levels. So another way of controlling adrenaline is to control insulin. And progesterone does both. It controls insulin and adrenaline. It's
Okay.
mostly, yeah.
Yeah, that's interesting. So actually, and also controlling that glycemic load as well, presumably, because if you're spiking your blood sugar with fast burning carbs and you're getting that big insulin spike, that's gonna you get a blood sugar spike initially, but then insulin removes it, and then if you're not eating again, then you're going to produce more adrenaline, right, to create more glucose.
Exactly. Yeah.
Okay, so you can kind of be on a roller coaster. So actually, for people that struggle with this, having a high sugar diet is probably very deleterious. I mean, it is for everyone, but particularly if you have an adrenaline problem.
You know, I've seen a lot of patients throughout the years, but one particularly stands out. He was a gentleman. He was about 47 years old, and the reason he came in to see me is that every morning he would wake up and vomit. Now, the only thing that will cause that kind of vomiting is adrenaline. You know, when you hear about women that vomit throughout their entire pregnancy, they call it hyperemesis gravidarum. That's also caused by adrenaline. You know, doctors don't realize that, but that's the cause. So the reason he came into was because he was vomiting every morning, and he also had severe fibromyalgia, which is not surprising because that's another condition caused by excess adrenaline. And so I put some progesterone cream on his arm, and he rubbed his arms together, and we started talking again. And after about 5 minutes, he sat back in the chair and he looked at me and he said, "Doc, in my entire life, I've never felt this good." And that's only after 5 minutes. So, you know, progesterone is it's a miracle hormone that really should have more publicity, if you will.
Sure.
Now, unfortunately, you know, most doctors that are prescribing progesterone are giving women oral progesterone now, like Prometrium. And the problem with oral progesterone is that it goes straight to the liver and it converts into a different hormone called allopregnanolone. 90% of oral progesterone is converted into a different hormone. It's not progesterone. So again, people should be aware that if they want the benefits of progesterone, they need to use a cream, not a pill, nothing oral. You know, no troches, just the cream, because the cream goes directly into the bloodstream. It bypasses the liver. And
because I'd also seen that, like, depending on your pathway in the body, whether it's an alpha pathway or not, the way you metabolize progesterone that you take orally can impact whether or not you do in fact sleep better. So not everybody taking oral progesterone is necessarily going to sleep better.
I've never seen anybody benefit from oral progesterone. I'll be
Never
honest
seen
with you.
anyone benefit from oral progesterone.
Yeah.
Okay.
Well,
So
they
you
have
would
women.
always use a cream.
Yeah, they have women take it at night because the side effect of oral progesterone is that it makes people sleepy. And but that's a side effect. It's not because but when people use progesterone cream, they also can sleep better because it's blocking adrenaline, which is what you want it to do.
Okay, that's interesting because my understanding with the oral one and the side effect was more the way it was metabolized, depending on which pathway you preferred, and if it was that alpha pathway. With the progesterone cream, how often would people be taking this? Because I think this will be interesting to a lot of women, particularly in perimenopause, when progesterone is low, and they develop anxiety quite often, right? How long would they, how often and how much would they need to be taking or using, should I say?
I usually recommend that when women are first, or men also, you know, men also need progesterone. That people, when they first start using progesterone, use it in accordance with how much adrenaline they have. So if they have a lot of symptoms of excess adrenaline, you know, the trouble sleeping, the anger issues, the trouble with tension in the back of the neck and the cold hand. If they have a lot of adrenaline, then I recommend that they use it 4 times a day until their adrenaline levels come down. And then twice a day is fine. What's nice about progesterone cream, you cannot overdose on it. You could use it 30 times a day.
Why is that?
I'm sorry?
Why can you not overdose on it?
You know, when women are pregnant, as you probably know, the placenta puts out progesterone, and they get incredibly high levels of progesterone, and I mean, levels that cannot be duplicated. And so if a woman and the fetus can tolerate that amount of progesterone, why shouldn't a normal person be able to tolerate a high dose of progesterone? Using it 30 times a day, which is obviously nobody that does that, but even using it 30 times a day will not duplicate the amount of progesterone that women produce when they're pregnant. So it's just a very safe hormone.
And when women are pregnant and they struggle with, constant nausea and vomiting, why are they getting that? I know you mentioned there that they have high levels of adrenaline, but given that progesterone itself is so high in pregnancy, why would they be experiencing so much sickness? Should it not be already offsetting adrenaline?
Well, actually, first of all, the first trimester, the first 3 months, the nausea and vomiting due to estrogen, not adrenaline. And progesterone also blocks estrogen, so it's good for morning sickness in the first trimester. Now, if the morning sickness persists into the second and third trimester, then we're dealing with adrenaline. And you're right, the placenta should be pouring out enough progesterone to control that. But in some women, they are producing so much adrenaline that even the amount of progesterone that the placenta is putting out is not enough to prevent that nausea and vomiting. But when women have hyperemesis gravidarum, not only do they need the cream, but I also recommend, the progesterone suppositories. And obviously eating correctly.
It's interesting because when I was pregnant, my first 2 pregnancies were with boys, and the nausea continued, the morning sickness, till for the first trimester. When I was pregnant a third time with my daughter, it continued right up until I gave birth.
But you only see this in creative type women, I should mention.
Okay.
The
the sickness. Right.
Well, it's just that creative women have a lot of adrenaline.
Okay, interesting. So I guess my concern, as being someone who likes to be creative and enjoy that side, is if I was to use something like progesterone cream, which you definitely piqued my interest in giving it a go, would I then lose some of that creativity?
Did you say that you'd lose some of the?
Would I lose some of that creativity? Let's assume that my creativity, like
people
who are creative, produce a lot of creative people produce a lot more adrenaline.
Right.
So therefore, one of the things that I enjoy is the creative side to my work. So if I was to begin to use progesterone and offset, I mean, I don't know if I have high adrenaline, but offset some of that, would I then lose some of the creative flair?
In all the years I've been dealing with this, I've never had anybody who has lost their creativity.
Okay.
But at the same time, you realize when you lower the adrenaline levels, your ability to focus improves. So there might be a slight decrease in the amount of creativity, but the ability to focus improves, which might sort of undo that.
Okay, that's interesting. Yeah. And does it vary day to day? Because for me, for example, I find that, there are some days when I feel a lot more relaxed. There are other days when I wake up wired at sort of 4:30. I'm an early riser anyway at 4:30 in the morning. And it's kind of hard it takes a bit of meditation and exercise to really create that laser focus. Does this vary naturally from day to day?
Adrenaline levels do vary from day to day, but basically once you should be able to control it very well just by eating correctly and using the progesterone cream. Your body will tell you what it needs. And like I say, you cannot hurt yourself with a progesterone cream.
And is there a specific strength that we should be looking for?
Absolutely.
Okay.
Absolutely. The amount required is a 5% progesterone cream. Now, 5% means that each pump is 50 milligrams. And 50 milligrams is the exact strength you need to block adrenaline. So the strength you want to look for is a 5% progesterone cream.
Okay, this is
Now,
interesting. Would you find that? Oh, sorry, you carry on, and then I'll ask you the question.
Usually over-the-counter progesterone is like 1 or 2%. So I just want.
So it's a prescription cream.
Well, the prescription cream you get from a compounding pharmacy, and they can give you a 5% cream. If people need it, they can get a 5% cream off my website without a prescription.
Okay, it's good to know. Would you then anticipate, for example, then if someone is having poor blood glucose control, obviously eating the vegetables, the coconut oil, this is going to go quite a way to helping with that, and the fiber in those foods helps with glucose. What about just using the progesterone cream? Would you expect to see better blood sugar balance?
Just using progesterone cream, they would get they would get somewhat of a balance, but incorporating the meal plan, which means vegetables and coconut oil and MCT oil, will enhance that, definitely enhance that. I don't know if I made that clear. Eating is probably more important than the cream. Eating correctly is probably more important than the cream is.
And so would you advise in people like this that listening to this and they're thinking that they have high adrenaline levels, that they don't leave long periods? How does intermittent fasting, for example, work in relation to people with high adrenaline?
I'm sorry. How does what work?
Sorry. So, like for people that you were mentioning around how adrenaline, if the brain doesn't have enough glucose, then the brain or the body will release adrenaline to fuel the hungry brain effectively. I'm just curious whether people with higher levels of adrenaline should avoid long periods of fasting. I know you mentioned at night that they may benefit from, having a meal before, or not a meal, but having something to eat before they go to bed. What about for people that maybe are thinking, actually, I like to fast until midday? Would that be something you would advise against?
It is something I would advise against. You're right.
Yeah.
Intermittent fasting does have some benefits, but not a lot of benefits for people with a lot of adrenaline, because if they go too long without eating, they will be living on adrenaline. And what they have to realize is that the reason why the body is releasing adrenaline is to raise sugar levels, for the brain. And now remember, I mentioned that adrenaline peaks at 2:30 in the morning. And this is when people are just lying in bed. And when the body releases adrenaline, which is a very powerful hormone, it creates stress to the body, and the body responds to stress by putting out cortisol. And the first thing cortisol does, it also raises glucose levels through a different process called glycogenolysis, where it converts glycogen into glucose. And so while people are lying in bed, they're producing two hormones that raise sugar. And what's interesting is that I am convinced that this is the number one cause of weight gain, and that people are actually gaining weight while they're sleeping and they're not aware of it. They exercise and diet during the day, but when they're sleeping, they're putting out all this adrenaline. So so people should be aware. So when they're fasting, again, the brain is not getting fuel, so the body will be putting out adrenaline. So so the bottom line is I don't recommend intermittent fasting, especially for people that are trying to lose weight. And that's why people, those are the number one kinds of people that use intermittent fasting for weight loss.
Yeah. It's interesting what you say there as well, because when you look at kind of some of the scientific research that's been done on lipid utilization, for example, it seems that we don't sort of use fats as effectively as we get older. So it's not necessarily that we're gaining weight because we're eating so much more all of a sudden and we're just storing more fat, but also really utilization is going down. And so that if that's the case, and people then have high levels of adrenaline and cortisol, we know that then when that glucose is released into the blood, insulin is released, and insulin blocks the burning of fat, right? So now you are storing more. So actually they could well be gaining weight while they sleep, which is probably not an appealing thought to most people. You want to be burning fat as you sleep.
Yeah, the way it is. But you're right, fat is the only food that doesn't stimulate insulin production. So,
Yeah. What about men then? You mentioned there that men stop producing progesterone at the age of 50.
right around that age. And what's interesting is that after the age of 50, men start developing prostate cancer. And keep in mind that prostate cancer is another cancer caused by estrogen. And so now they have nothing to block. Progesterone also blocks estrogen along with insulin and adrenaline. So now they have nothing to block estrogen. So men can develop prostate cancer. And the other thing is that men also start putting on weight around the middle because now they have no progesterone, they have no hormone blocking insulin. So progesterone, it's an important hormone for men also. It's like, just as it's important for women. Um, and I think I mentioned that progesterone is good for colic in babies. If you have a baby with colic, you just rub some progesterone cream on the baby's belly. It'll go away in anywhere from 3 to 5 minutes instead of
I
staying up
wish
with a
I'd known
crying.
that a few years ago when mine
Well,
was
yeah,
young.
women and men stay up all night with a crying baby, but they don't have to.
Yeah,
Um,
it's
you
incredible.
know, well, it comes down to treating the cause of illness, and unfortunately, there's very little training with regard to the cause of illness.
And is there any other interplay when we're looking at progesterone? And you were mentioning there around creativity and focus, and taking progesterone will help to sharpen that focus. Is there any other interplay when you're using progesterone cream between, obviously, if it's blocking adrenaline, is it enhancing any of the other neurotransmitters that may enhance things like focus and flow, like dopamine or anandamine and anything like that?
I have to apologize.
Norepinephrine.
I'm not a scientist,
Yeah. I was just
so
curious if you'd seen any research around it.
I have not. Progesterone's been, for the most part, sort of like an ignored hormone, and it shouldn't be. Um,
Yeah,
but it all
interesting.
comes down to basically is that whatever works. And but the but I think if more people were aware of how many conditions are related to excess adrenaline, um, I mentioned fibromyalgia. That it's a condition that's considered incurable. Um, and that takes anywhere from 3 days to 3 weeks to get rid of, just by lowering adrenaline. There's a condition called chronic interstitial cystitis, which is also caused by too much adrenaline, and that can go away in about 2 weeks. The PMDD, premenstrual dysphoric disorder, considered incurable, always treated with antidepressants, which do nothing. The road rage goes away in 24 hours just by lowering adrenaline. So I'm just saying, and these are the conditions that people can get rid of at home without even going to see a doctor. They can start eating correctly and using some progesterone cream.
What about people that are considered kind of adrenaline junkies and they're looking for extreme sports to provide that
Well,
stimulation?
unfortunately, well, they live on adrenaline, and so they're utilizing adrenaline to enhance whatever it is, the thrill that they're looking for. I'm not recommending that, but athletes have an incredible amount of excess adrenaline, but that's what makes them good in sports. People in the army and people in law enforcement always have high levels of adrenaline, and again, this is utilized in their work, but it also causes them to be quick to anger, or need to get into drugs or alcohol just to relax. Or if you look at people involved in the sports industry, there's a lot of wife beating, and I'm just saying adrenaline is a very powerful hormone. um, the and while we're talking about sports injuries, football, um, they get a lot of head injuries, and progesterone is actually the drug of choice for traumatic brain injury because it reduces swelling in the brain. And so um, and again, this is unknown to people that have sports teams. I think we could do a lot better in terms of letting people know how to get, it. And a lot of it, people have to take responsibility for their own health. And unfortunately, you can't rely on a medical system that has no interest in their being healthy. So.
And how did you come to find this? Because it's not something that's well known about. How did you hit upon the fact that
It's an excellent.
adrenaline was so key in all these diseases?
My mother died at the age of 61 of breast cancer. And right after she died, I realized that I had inherited her hormones. I can remember I said men and women had the same hormones. And this is back many, many years ago. And in those days, every time I was driving, I used to have to slap my face trying to keep my eyes open. So I knew I was getting low blood sugars. And the only thing that'll cause low blood sugars is too much insulin. And the thing about insulin, insulin puts on weight around the middle, and my mother had some excess weight around the middle. And she had breast cancer, so I knew she was low in progesterone. So I started using progesterone. And from that day, I have never, ever had an episode of sleepiness while driving. So I knew that progesterone controlled insulin. But what happened was that it got me intrigued about hormones, bioidentical hormones. So I learned, I tried to learn as much as I could about these bioidentical hormones. And I devoted my practice to treating people with hormones. But I had the advantage of being able to sit down for about 2 hours with every patient and talk to them. And I learned how the body operated, and I learned how the body responds to hormones. And this is called observational-based medicine. Unfortunately, we have a system which is called evidence-based medicine. That's what doctors, their golden thing is evidence-based medicine. But that's drug companies, that do evidence-based medicine because they can afford to. But medicine always developed based on observation over 1,000 years. Doctors observed what happened. So I was able to observe how people responded to hormones, and which is helpful. My first book was called The Miracle of Bioidentical Hormones, and it literally brought thousands of patients to my office from all over the country and all over the world came in because of this book. It's gotten 11 literary awards. Of course, the medical board in California felt the ideas were dangerous, but anyway. But hormones control everything in the body. Everything is controlled by hormones, and unfortunately, doctors get no training in hormones.
No. And I think you also mentioned other kind of conditions. You mentioned ADD earlier, but also autism you mentioned in the book. Have you found progesterone therapy useful for autism?
Exceptionally useful. Children with autism have incredibly high levels of adrenaline. And so they respond very well to eating correctly and using progesterone cream. Kids that do not talk, they start verbalizing. And usually they have a lot to say. So those children with autism that who have temper tantrums, the temper tantrums go away. Anyway, they respond very positively to lowering adrenaline.
So it seems like it's suitable for everyone from babies right up.
It's what's nice about it, you can't hurt anybody with it.
Yeah, because I guess that was going to be my question is, what about teenagers? Their hormones are changing. Teenage boys are getting more testosterone. Is there any downside to them using something like a progesterone cream?
It doesn't really affect other hormones because there's no such thing as a progesterone stimulating hormone. So you're not suppressing that. But, there are conditions, women get like fibroids and endometriosis and polycystic ovaries, all caused by too much estrogen. and women are put on birth control pills, and so they stop ovulating, which means they stop making progesterone. So they take away the most important hormone in their body, which is progesterone. And doctors, and so every woman on birth control pills should be on progesterone, but they're not.
And it would offset this estrogen dominance that they're
you know, frankly, women get abused by our medical system. I'm just saying that's the way it is.
I think a lot of women don't feel listened to. Interesting. Thank you very much. Are there any last tips you'd like to share before we link to your book and where people can find more about you and your work?
Well, I do have a website, and there's a lot of information on there. And I'm always available. Actually, you know, I would assume that most of your listeners are in England.
About 30% or more listeners actually are in North America.
But let me tell you something. You know, there's a doctor in England that actually did the most for getting progesterone on the map. I think Dawson. I'm sorry, I'm drawing a blank here, but yeah, she was not. I don't think she was well taken care of. but she's the one that used to recommend really high dosages of progesterone for women with PMS and what she didn't call it that, but they had PMDD, premenstrual dysphoric disorder,
which is debilitating for many women.
Yeah. So anyway, yeah, I have a website. It's www.plattwellness.com, and there's a place where they can send in questions, and you know, and I do respond to the question.
And that's on the website, is it?
On the website.
On the website, brilliant. And they can also find your book on Amazon. Books, should I say? And we can also find your books on Amazon, or presumably in any good bookstore.
Well, you know, somebody put another book with the same title called Adrenaline Dominance, which is 55 pages long, and it was completely undecipherable. Anyway, they took my book off and left that and put that book on, and so they can get the book on my website. And you know, dealing with Amazon is very tough. I mean, dealing with anyway.
I think your book is available on Amazon UK.
Really?
Yeah.
Well, really? Okay.
But we will link to all of that in the show notes. Thank you so much for coming on the show and sharing your time today and enlightening us on progesterone specifically, and also on the impacts of adrenaline, which seem to be very far reaching. Thank you so much.
It's been a pleasure. Thank you for having me.